Hello, this is Dr. Sargisian, and I'd like to talk to you about Exam 3 review. This is not a comprehensive review for Exam 3, and you already had a review guide, but I want to touch base on a few of the topics in there. And again, this is the select topics for this. Select doesn't mean that it's all topics covered in the exam will be discussed here. The review will focus on cardiovascular, gastrointestinal, and prostate reproductive problems. So let's talk about hypertension while we're talking about while we're talking about cardiovascular. So again, we are still struggling to maintain control of blood pressure in elderly population. Again, we have great number of medications, but it's still very difficult to achieve. So if someone tells you that they have 100% of their population control of their blood pressure they see in their clinic, they're probably telling you a little bit exaggeration or embellishment, but you still need to remember that this is only our hope that we will control it at some time. So sometimes medication used to control hypertension will cause hypotension or orthostatic hypertension, or sometimes it just won't be controlling it as well as we need. So why it's difficult to control hypertension in older adults? Older adults have increased arterial stiffness. They have decreased or decline in baroreflex sensitivity and alteration in renal function. These changes are fairly typical in elderly population. So because of all that, you even may have difficulty controlling blood pressure in a patient who you had no problems controlling the blood pressure before a few years ago. Let's remember the new guidelines for hypertension management for JNC 8 in patients 18 to 59 without major comorbidities, and in patients over 60 with chronic kidney disease, with diabetes. Your blood pressure goal should be less than 140 over 90. All the blood pressure machines you see in retail pharmacies, big box stores, airports, whatever, fast food restaurants, they are everywhere, but most of them they don't have JNC 8. So please don't pick pre-hypertension. Just remember that parameters. If someone is young or if they have kidney disease and diabetes, their blood pressure should be under 140 over 90. If it's someone who is over 60, their blood pressure can be over 150 over 90. So please remember that. Another cardiovascular issue I would like to talk about is syncope or syncopal episode. First and foremost, you need to find out what causes syncope. Sometimes it's a valvular disease. In other cases, it's supraventricular tachycardia. If the cause of syncope is supraventricular tachycardia, of course the best approach will be to start a cardiac ablation or refer the patient to cardiac ablation. On the other hand, before treatment of any kind, we need to diagnose the patient with this, right? To find out what's happening. So how you assess the patient with syncope? You have to proceed with several steps when you're looking at a patient with syncopal episodes, and it can be a thorough neurologic exam. You have to listen to carotid arteries to check for carotid bruits. And you have to auscultate heart sound, listen for murmurs, gallops, and rubs. You want to rule out valvular abnormalities as a source of syncope. And based on your assessment findings, you will choose one or the other route of further diagnostic evaluation. But again, if you think the patient with syncope first time, you have to start with physical exam, do neuro exam, check for carotid bruits, and listen for heart sounds, and just listen for murmurs, gallops, and throbs. So another cardiovascular problem is the heart failure is relatively common in elderly. Of course, myocardial infarction can lead to heart failure. However, you need to realize that hypertension is one of the leading causes or the leading cause for developing heart failure in older adults. Heart failure can be diagnosed by evaluating the ejection fraction and basically referring patient to cardiac echo or echocardiogram. Please know the stages of heart failure. At the same time, please review the medications that will be used for treatment of heart failure in all stages, and especially pay special focus for the advanced heart failure treatment. You need to know what are the add-ons to regular diuretics you use, but what will be the add-on? Think about it. What will be the add-on if LASIK doesn't work? To finish this review, I'd like to talk about prostate problem. Many men can encounter when they get older. It's fairly common, and you also need to know how to evaluate what symptoms the patient will have. Frequency of urination, difficulty starting urine, and so on. Also, part of this is like looking for prostate problems should be your ability to look for prostate cancers, what kind of examination you use, or laboratory workup. On the other hand, as any cancer, you need to know TNM system with prostate cancer. You also need to know the Gleason score and what it means for prostate cancer diagnostics. So this concludes the review for this topic and for this exam, and I wish you good luck on this examination, and I'll see you next time. Thank you.